What surprising legal battles influenced telehealth licensure? Imagine trying to see a doctor across state lines and hitting a legal wall. That's exactly what some of the biggest legal fights in telehealth have been about. These battles have shaped how doctors can legally provide remote care today. One major case took place in New Jersey. A doctor and some patients challenged the state's rule that doctors must be licensed in the state where the patient is located. They argued this rule limited access to care and was unfair. The state said that medical practice happens where the patient is, so doctors need in-state licenses. This case made people question if these rules should change to fit the digital age. Another big fight was in Texas. The Texas Medical Board created rules that restricted telehealth services. Telemedicine companies like Teladoc pushed back. Federal agencies, including the Department of Justice and the Federal Trade Commission, supported Teladoc. They said the Texas rules blocked competition and made it harder for patients to get care. A federal judge stepped in and issued a preliminary order stopping Texas from enforcing those rules. This showed that federal laws can sometimes override state rules to keep telehealth accessible and competitive. During the COVID-19 pandemic, many states temporarily relaxed licensure rules. This meant doctors could treat patients in other states without getting multiple licenses. It helped a lot of people get care quickly. But as the emergency orders expired, states went back to their old rules. That caused some telehealth services to pause or cancel appointments. For example, Johns Hopkins Medicine had to cancel some virtual visits because they didn't have licensed doctors in those states anymore. This back and forth has made it clear that the legal landscape for telehealth is still changing. These legal battles reveal a tug-of-war. States want to control medical practice to protect patients and generate revenue. But the telehealth industry wants more flexibility to serve patients across state borders. Some healthcare providers worry that loosening rules might lead to more competition and fewer patients. This makes setting up telehealth appointments more complicated. Providers need to know where the patient is located and hold the right licenses. Many platforms now help with this by employing licensed providers in each state. In the end, these legal fights have pushed the conversation forward. They show how traditional rules clash with the digital world of healthcare. As laws continue to evolve, they will shape how easy or hard it is to access telehealth services across the country. Understanding these battles helps patients and providers navigate the complex rules around telehealth licensure today.